Is there a danger though, almost the counter argument to that? I'm just wondering, would it be a case of if let's say the patient, like you say, has got quite bow legs or whatever it would be, and that you argue that their biomechanics in the first place was somewhat faulty. If you replicate that, you replicate a more normal feeling knee, but do you then run the risk of meaning that prosthesis wears out quicker because you're then just replicating their faulty biomechanics? Is that ever an issue?
I think it's definitely something to think about, and again, one can definitely overthink this, and this is the problem. You sit in orthopedic circles, and you can go around, and that's where the thing is that it's actually not so much, one is necessarily better than the other. I think you've got to look at patients. I think where patients are very very bowed or very valgus, where we see in sort of certain rheumatoid patients or kind of Afro-Caribbean populations, that sort of thing. You need to be looking at, you need to ask yourself the question as, what am I trying to recreate here? Because, you can get it wrong. You can get it wrong by bringing it back where they should be, or get it wrong by correcting it to neutral. But the question is, you need to understand, what are you trying to achieve? It's not just you go in, I had a consultant colleague, just for anecdotally, said I can teach anyone how to do a knee replacement. It's that easy,
Yeah.
And the argument is you can, it's just, it's a question, making cuts, but actually it's thinking about the actual patient and biomechanics and what you're trying to achieve is, and
what that patient is, what their aspirations is, and what you might do for somebody perhaps who's got severe problems in their 40s and 50s may be different to what you might do in their 70s, because they may want to be the younger one may want to be more active.
I think
make a true decision.
Absolutely. I think there's definitely been a vogue from going from more mechanical to kinematic, which is this natural kind of 3 degrees of errors. And, as I say, something, new companies come in and they're promoting different things. I say natural alignment is the next thing that sort of, come along. I think it's just, you've got to understand all the nuances of these and decide on, what you're trying to achieve, for that patient.